How is coaching different from therapy, counseling, consulting, and mentoring? To answer that question, let's look at what they have in common first. In all five, the client, as an individual or organization, needs to overcome some internal or external challenges in order to meet their desired outcome. That's where the similarity ends. To best understand the differences, it's good to think about all interventions on two axes. One, telling and asking, and two, past and future. Consulting and mentoring are very firmly in the telling and future quarter. Therapy is also telling, but it's also in the past. Counseling is in the past and is asking, while coaching is future focused, but also asking. Let's look at all of these one by one. Consulting someone or an organization requires that the consultant has the experience and expertise in the challenge faced by the client. Both consulting and coaching are future focused. Consulting is a direct solution based approach, whereas coaching is an exploratory awareness creation approach. Mentoring is often close to coaching. In fact, the European Mentoring and Coaching Council, EMCC, recognizes mentoring as an integral part of coaching as long as mentoring is not confused with providing a solution. Many corporate executives are more comfortable with a coach who has walked the talk, with experience and expertise to also mentor them within a coaching framework. They are not looking for theorists, but practitioners who can help them find a solution. Most coaches do wear the mentor's hat on occasion. Next, we have therapy. Many psychological interventions focus on uncovering the past in order to help the client overcome traumas. All of these sorts of therapies are focused on the past and, to some extent, are based on the directive telling approach. Carl Rogers attempted to change this to a client centric, explorative approach, resulting in counseling as an intervention. Coaching is a far more future based, asking approach, and coaches are generally warned not to follow therapeutic approaches, even if they are qualified without explicit client permission. Counseling is much closer to coaching than other psychological therapeutic interventions. It is more focused on listening and asking. However, its focus is still more on helping the client overcome past experiences, especially ones dealing with emotional traumas. Many subjects that traditionally were counselors' space of expertise, such as relationship, grief, and loss, are now capably handled by coaches using outcome oriented approaches. Coaching is partnering with clients in a thought provoking and creative process that inspires them to maximize their personal and professional potential. A coach helps the client get from point A to point B. Coach never tells the client what to do. Coach asks. Coach doesn't dwell on the past. Coach focuses on the future. Coach's self-awareness is critical to creating client awareness. Coach must partner with the client in empathy as an equal, sharing from the heart what is felt appropriately and authentically. Coach's role is to be present and listen actively so that the coach can ask questions that generate insights for the client. This can only be achieved if the coach offers unconditional positive regard for the client, the belief that the client can achieve their goal, move from point A to point B. Do you want to become a coach? Join our accredited coach training program. Visit coacharya.com for more information. That's COACHARYA.com.